Hello and welcome. Thank you for making it to the afternoon. I know these are marathon days. So my name is Olivia and I work for Tictrac, a dialogue company, and we're talking about recession-proofing your well-being strategy. So timely stuff for sure. I started out my career in health and biology. I have a degree in neurobiology, and I actually thought that I wanted to be a medical doctor until I realized that the private sector has a lot of room for innovation and kind of improving people's well-being through employers such as yourself. So, without further ado, let's talk about the trends. A note that my very esteemed clinical colleagues are unfortunately unable to join in person today, so you'll hear from them on video from Australia and Canada. So, trends. Mental health continues to decline. This is something that's probably not new to all of you, but the stats are pretty shocking. So we know that 65% of British adults say that their mental health is actually worse than the pre-pandemic levels. And yet when people have challenges, they're unable to get the support that they need. So we know that about a third of those who need care are unable to access it. And probably you as HR professionals are seeing the results of this. We know that short-term and long-term disability costs have only skyrocketed, and many of those claims are coming from mental health. But we're not in the recession anymore, right? We're all here, we're in person, and that's exciting. But we are going headlong into a cost of living crisis and a recession. And from looking at prior recessions, we know that this will only make the mental health crisis worse. The study here shows that the number of debts that somebody has greatly increases their likelihood of developing mental health issues. Furthermore, we know from prior recessions that there's increased depression, anxiety, substance abuse, and very sadly, suicidality. So when we think about the context, where are we? We are living in tough times. We know that. I live it, you live it. Teams are being told to do more with less. They are often having maybe reduced workforces or reduced budgets and being told to reevaluate, are those benefits really serving the needs of the workforce? Are they leading to the engagement, the ROI, and the results that were promised? So this is a challenge. And we know people are coming out of the pandemic, seeing the increased impact of mental health, and also when people have been working from home, increased sedentariness and social isolation and challenges there. And that's all about the backdrop as we think about the future. So how do we come up with a solution to support our workforce when they're dealing with all of these challenges? At Tictrac and Dialogue, we believe that the solution is digital tools because we can innovate and we can mimic human interactions wherever possible to help people have healthier behaviors and kind of be along their health and well-being journey. And this allows us to have scalable, cost-effective tools that decrease the barriers to accessing the services that people need the most. So you might be thinking, this all sounds great. What in the world do these digital tools mean? Well, we will give you some examples. So here we have our clinical experts that are going to be speaking. First, Dr. Robin, who is a family physician, and he will talk through a very typical patient story of what he sees and how health and lifestyle factors have a huge impact on people's well-being and what we can do with those digital tools to improve his overall well-being. And Dr. Kylie Bennett, who is an expert on something called CBT, or self-led therapy, and she has been in this field for many years and is going to tell you a bit more about it. So here's Robert's story, somebody who consulted with our physician, Dr. Robin, and was really struggling with some of the impacts of the pandemic. And so our doctor is going to walk through what we can do to support him.
Hi, everyone. Dr. Marc Robin. I'm a family physician and the medical director here at the Dialogue. Great to be with you today. Robert's story represents real interactions shared by many and really, in a lot of ways, speaks to a new reality for a lot of us. And as a virtual care physician, I've met so many people who have shared similar stories than Robert's in the last year. Robert here is having sleep issues. It's starting to impact on his functioning during the day, and he's looking for solutions. And he's starting to think that maybe a sleep aid might help him. But as we explore Robert's sleep issues, we learn that, like many, Robert works remotely. He lives alone. And although he likes the idea of working from home, it seems to him that his work days have only extended in the last year. He used to go to the gym, but with the gym closing during confinement, he had to stop going, and he's become more and more sedentary. He often has dinner in tete-a-tete with his laptop, and in fact, it's often not really dinner, but more like snacking while answering emails. And by the time he catches up to all his to-do lists, it's late. He shuts down his computers and goes straight to sleep. So from this story, which is very common, by the way, and we can clearly see that Robert is not suffering from some kind of chemical imbalance. He's having work-life imbalance. And it's a lot of what we see. And Robert hasn't picked up any bad habits along the way. He's just lost touch, with his healthy habits. And he realizes that, but he doesn't know where to start. He is motivated to make some changes. And how do we empower him? So we asked Robert to consider using digital tools and a collection of healthy habits to choose up to 3 habits that resonate with him. In this case, perhaps Robert would choose to create a clean break between work life and personal life, and maybe set a timer and put the music on at the end of the day, and so he can prepare and have a proper dinner. It doesn't mean that he can't return to his laptop and complete his day, but he might commit to adopting a healthy habit of shutting down his screen an hour before bedtime. And doing some stretches before going to bed is something that he relates to and that he might commit to adopt as well. So by adopting these 3 meaningful but small behavior changes, it goes a long way for Robert to perhaps find restorative sleep again.
So there's a little bit about Robert. You will hear the word habits a lot. And it's one thing to come up with an idea of something I'm going to do differently, but how do you remember? How do you be held accountable? How do you get that satisfaction of completing that habit until it becomes a normal reality? And so that's some of the things that we offer through those digital tools right from your smartphone to keep you on track in between maybe those clinical appointments. Next, we will have Dr. Kylie Bennett talk about ICBT. And this is a really revolutionary way to support people's mental health when there's a lot of stigma still, and reduce those barriers to care, because sometimes not a lot of people are ready to take that step to talk to a clinician live.
Hi, I'm Kylie Bennett. I'm the Mental Health Program Director at Dialogue. So poor mental health is estimated to cost UK employers approximately £45 billion a year, according to a recent report by Deloitte and Mind. So it's not surprising that many organisations are reassessing their mental health support programs. Now, one effective and accessible way to support your workforce during the mental health crisis that is growing at the moment is to offer digital cognitive behaviour therapy. So that's digital CBT or ICBT, which just means internet delivered CBT. So although mental health initiatives have become increasingly widespread within organisations, unfortunately, there's still a stigma attached to seeking help. So for example, to booking an appointment with a therapist. Digital CBT reduces barriers to seeking help. It offers the opportunity for employees who are hesitant to seek help to get the support they need at a time and at a speed and at a location that suits them best. So Digital CBT provides self-led training in psychological therapies that have proven effectiveness for managing and treating common mental health problems. So it includes evidence-based information, interactive exercises, and practical examples to challenge unhelpful thinking and behaviours and to improve relationships. Our Digital CBT program includes toolkits focusing specifically on depression, anxiety and worry, social anxiety, as well as toolkits for divorce and separation and loss and bereavement. These are significant life events which put individuals at significant risk of developing mental health issues. Now, when learning about digital CBT, many people are skeptical that a digital therapy solution with no human interaction could actually work and deliver results. But as someone who's been involved in this field for more than 20 years, I want to assure you that yes, it works. There's a large body of global evidence demonstrating the effectiveness of digital CBT. Our digital CBT specifically has been evaluated in high quality research, including 8 randomized controlled trials, and these have been reported in peer-reviewed journals. So outcomes of those trials include decreased symptoms of depression in adults with clinical depression, and that's even after 12 months after they've used the program, as well as improvements in self-esteem, empowerment, and perceived quality of life. Another study in adults aged 55 years and older found use of the program significantly reduced symptoms of both depression and anxiety and increased self-reported productivity at work, ability to cope with everyday stress, and enjoyment of life. So traditional therapy is a main staple of many organisations' mental health programs, but in-person or even live or virtual therapy isn't necessarily for everyone. Digital CBT is a cost-effective and accessible alternative which empowers employees to learn about and manage their own mental health. Providing access to digital CBT enables employees to build resilience, manage mental health symptoms, and cope with life stresses in a capacity and a cadence that they're comfortable with.
All right. So you've heard it from the experts. There's really exciting things that we can do through technology to materially impact people's health. And that means that you can also measure that as an employer and be able to see the results of your investment. So here's an example of some of those digital tools. We know from research that one of the best things we can do for people's mental health is to be a little bit more active. To support that, we can track active minutes through a application. We can engage with digital CBT to manage symptoms of anxiety, depression, etc. And we can have an introspective measure to see at a quantitative number, how is somebody doing in their mental health, and how do we aggregate that up for the organization and see trends over time to be able to have targeted well-being strategies. We also have healthy habits, things that I talked about earlier to help nudge individuals, improve their activity, their sleep, their nutrition, and be reminded, kind of like a little digital accountability partner to improve their lifestyle. Digital CBT includes a lot of research-proven toolkits and interactive features. We can go more into that at a different time. So some of the takeaways about what we've seen. Number one is mental health continues to be a challenge, from the lasting results of the pandemic, from worsening physical and mental health, straight long into the cost of living crisis and the recession that we're all living through. Number two, there is an increased pressure on teams to do more with less, which increases strain and worry and anxiety. So what do we do? In times like these, which are really tough, we can have digital tools which are scalable and very cost-effective, which means that a global distributed workforce can have access to things that materially improve their mental health and their well-being. This allows employees to feel supported wherever they are on their well-being journey and adopt healthier habits that lead to lasting behavior change. What does this mean? It means that you have a healthier workforce, a more resilient workforce that is ready for the challenges of tomorrow. I've gone rapid fire through this. Obviously, there's a lot to this topic, and so highly encourage you to join our webinar, which is on the 29th, and you'll hear from our experts a little bit more live than today and have a discussion diving deeper into those digital tools, also success strategies for implementing well-being initiatives, making sure that they have high adoption and success, and tracking the results of those with insights and reporting. So we have a bunch of handouts and papers. Rachel and Cecilia at the back, they're standing right at the door, have things like that. And please, please come talk to us at the booth. We'd love to hear your feedback on things and share a bit more about the webinar. We also have these really great booklet about wellness strategies. We've spoken to HR professionals and aggregated the insights they have when they've deployed successful well-being strategies in their organization. So if you come to the booth, you can come pick this up, and we'd love to chat with you. I think I have less than 5 minutes, so we can probably take 1 or 2 questions.